I'm Dr. Purnima Upadhyaya Pandalpalli, and I am here today to discuss with you the COVID-19 virus, the epidemic, which has turned into a pandemic now, because it is affecting every single continent except for Antarctica at this point of time. Every single continent has had thousands of people infected with this virus, which belongs to the coronavirus family, which is not all that supposed to be that dangerous, but it is one of the new ones, or this particular strain or species or the type of coronavirus was not seen before. That is why we do not have immunity against this particular virus. You've heard there's so much information that's available out there, and I'm sure that you're very well aware of the origin of this virus. There are many conspiracy theories going on as well, and I highly encourage us not to get involved in those things. And again, I don't even want to talk about this as a particular country that was responsible for, or that's where it came from, and that is one of the reasons, as you see, we are avoiding the terminology actually of using the name of the place or the origin of this virus as the name for the virus, because that does create some sort of it's understandable at the same time, but irrespective, it is of no value at this time. So in a situation like this, when we're in a crisis mode, it is very imperative, it's important to focus on what matters the most. What matters the most right now is to limit the mortality from this virus, meaning we have to stop and try to reduce the death rate from this viral infection. Now the next thing would be to decrease the level or decrease the extent of infection. Okay, now of course both of these things are kind of related to each other, but to control the spread of infection or the virus in the general population. All that being said, ultimately the thing that's going to be our savior is going to be our own immunity, as you know. And the reason we are having trouble right now is because we are not immune to this virus, because we have never seen this virus before. That's the reason. Now, if you give it, it will invariably, what will happen is that in spite of all the isolation, the social distancing, quarantines, lockdowns, everything, this virus is going to spread across the population and will create what is called herd immunity. And that herd immunity is critical for our survival. Herd immunity becomes significant enough or good enough once about 50 to 60% of any population has gotten infected with a particular strain of the microbial you're talking about. It could be virus, it could be bacteria, whatever. So in this particular case, ultimately it's going to be the herd immunity, which is the immunity that I have, you have, we all have against that particular virus, which is going to save us. Now, that will take time. This is what we have to understand. It's going to take time. It's going to take 3 to 4 to maybe 6 months for us to be able to get significantly sustainable degree of herd immunity.
यदि आप इस तरह ही हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करें ये चैनल द हेल्थ केयर टुडे और बेल आइकन दबाएं ताकि हर नए वीडियो का नोटिफिकेशन सबसे पहले आपको मिले.
Until that happens, we will have to protect ourselves from getting this infection. So this is kind of a little bit, isn't it a bit ironic? And on one side, I'm telling you that we must protect ourselves from getting the infection. We should try to, isolate ourselves, limit the amount of exposure. And on the other hand, I'm telling you that until and unless 50 to 60% of our population becomes exposed, not infected. Infection means it has affected the physiologic normal function of the body. So we don't want that. We just want exposure. So until and unless about 60 to 70% of the population gets exposed to this virus, we will not be able to develop what we call the herd immunity. And until unless we have herd immunity which is robust, we will not be able to fight this virus, because there's no real treatment as such, like an antiviral. Unfortunately, we have never been able to develop a very effective antiviral medication against these common viruses actually. You know that we do have very effective therapy for the human immunodeficiency virus, right? So the HIV. We also have effective treatments against other types of viruses such as herpes. But we do not have effective treatment against the most common virus, which is the coronavirus family. So this coronavirus is a problem because it is new. It is a problem because we are not exposed to this virus. It is a problem because we do not have the herd immunity. And it's a problem because it is predominantly affecting the lung and the upper respiratory tract, mostly the lung. So once the infection, if it stays up here on the nose, mouth, face, or the neck, throat, that's doable. But once it goes down into the lungs and causes pneumonia, then it is a problem. Then it is, it deteriorates quite rapidly actually, with significant what we call as acute respiratory distress syndrome, or ARDS, needing ventilation, mechanical ventilation, which is highly cumbersome and difficult to provide as a treatment to a large population. Even in a country such as Italy, as you've heard all this different news and everything, and I'm not going to repeat that stuff, it has become a nightmare, literally. Here in America, it will become an unsustainable nightmare, a disaster, if we are not able to kind of slowly slow down the population exposure. So the population will get exposed. The population should get exposed. The population, once gets exposed, will only then it will develop the herd immunity. But it has to happen slowly. If it happens fast, and all of these people get pneumonia, our systems cannot sustain it. So you have heard this word, flatten the curve, meaning, yes, we all will get exposed to this, but just let's take our time. So how do we know? So think of it like a huge river, and we have a dam, okay? So the dam is protecting this huge water from hitting our town. Now, the water will seep in here eventually, but we don't want this huge wave to hit us. So that's the flattening the curve we're talking about. Now, how can we do this? Meaning, let's take turns. For lack of better terminology, let's just take turn. It's my turn to get infected or my turn to get exposed. Let me have it. You stay at home. You will get your chance too. Don't worry. You will get your turn. Let your turn be about 3 to 4 months from now. So you stay away from there, because someone like me or me, I'm going to be getting exposed. And the ones who are going to get exposed, if they are young, if they are healthy, if they do not have any other underlying medical conditions, they are highly likely to recover from it. Who cannot recover? The elderly, the ones who have significant cardiopulmonary conditions, heart disease, congestive heart failure, and a bit controversial, but certain people who take certain medications also. We'll talk about that next. Take care.